In the heart of a frenetic metropolis, a transformative dialogue is unfolding that might just significantly alter a life. A renowned cardiologist, Dr. Miller, a man of profound wisdom and vast experience, is holding a meeting with Noah, an enthusiastic, bright-eyed medical student who is keenly eager to gain knowledge. Their conversation is centered on Henry, a patient who is grappling with disconcerting symptoms of an as-yet undetermined disease. Henry has been battling with debilitating shortness of breath, unexplained and abrupt weight gain, along with unsettling swelling in his legs. Dr. Miller, with his profound understanding of the human body, begins to demystify the enigma surrounding Henry's condition. He begins to discuss the concept of increased hydrostatic pressure, which is essentially the force exerted by fluids, such as blood, against the walls of their container, in this case, the blood vessels. This pressure is essential for the circulation of blood, but when it increases, it can lead to complications. He elucidates that high hydrostatic pressure can push fluids out of the blood vessels into the surrounding body tissues, which might result in fluid overload or accumulation, commonly known as edema. This is because the higher pressure overpowers the osmotic force that usually holds fluids within the vessels, causing a net movement of fluids into the tissues. This whole process can create a strain on the body, leading to various symptoms and complications. Dr. Miller further explains the potential sources of such an increase in hydrostatic pressure. These may range from heart failure, where the heart is unable to pump blood efficiently, leading to a buildup of pressure, to like pregnancy, where the growing uterus can exert pressure on blood vessels. Certain drugs can also raise blood pressure or alter the balance of fluids in the body, contributing to this condition. He even mentions iatrogenic causes such as excessive use of intravenous fluids. Through his medical wisdom and adeptness, Dr. Miller simplifies these complex concepts, ensuring that both Noah and Henry follow his line of reasoning. Dr. Miller doesn't halt his exploration at that point. He dives even deeper, meticulously explaining how decreased oncotic pressure, also known as hypoalbuminemia, can lead to similar symptoms. He elaborates that decreased oncotic pressure occurs when there are low levels of albumin in the blood. Albumin, a protein made by the liver, helps keep fluid in your bloodstream so it doesn't leak into other tissues. But when albumin levels drop, fluid can escape the blood vessels, resulting in swelling. He continues to highlight nephrotic syndrome, liver cirrhosis, and malnutrition as possible sources of hypoalbuminemia. His explanations, like a river, flow smoothly, imbued with significant medical knowledge that both Noah and Henry eagerly soak up. Dr. Miller begins by diving deeply into the subject of increased capillary permeability, a condition that often develops as a result of severe sepsis. He elucidates how this condition can lead to fluids leaking from the capillaries into the surrounding tissues. This leakage can cause swelling and, if severe, can disrupt normal function of organs, leading to potentially life-threatening situations. Not stopping there, Dr. Miller unpacks the hormonal causes in more detail. He touches upon hyperthyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormones. These hormones are integral for the body's metabolism, and a shortage can lead to a host of complications. Exogenous steroids, often used for anti-inflammatory purposes, can also cause fluid retention if used in excess. He then moves on to discuss pregnancy, a state where elevated hormone levels can lead to fluid retention. Furthermore, he discusses how estrogens, a group of sex hormones responsible for the development and regulation of the female reproductive system and secondary sex characteristics, can also cause fluid retention. Dr. Miller's explanation is exhaustive and meticulous, capturing the attention of everyone in the room. From medical students striving to understand the complexities of these conditions to patients who are personally affected, everyone is engrossed. In this scene, we take a pause from our deep dive into the causes of fluid retention to reflect on the journey so far. Our voiceover reiterates the key points from Dr. Miller's explanations, ensuring that the audience keeps up with the complex medical terms and concepts being introduced. Let's take a moment to summarize the causes we've discussed so far. We started with increased hydrostatic pressure, which can result from conditions such as heart failure or kidney disease. Next, we moved on to decreased oncotic pressure, a condition often seen in malnutrition and liver diseases. We then delved into increased capillary permeability, a consequence of severe sepsis, where fluids leak from the capillaries into the surrounding tissues. We also learned that this can lead to swelling and potentially life-threatening disruptions to organ function. Finally, we explored the hormonal causes of fluid retention. We learned about hyperthyroidism, a condition where the thyroid gland doesn't produce enough hormones, leading to a host of complications. We also discovered that exogenous steroids and estrogens can cause fluid retention if used in excess or during pregnancy. Remember, these are complex conditions that require expert medical knowledge to diagnose and treat. So, as we move forward, let's keep in mind Dr. Miller's advice on the importance of individual consultations for a precise diagnosis and personalized treatment plan. As our conversation comes to an end, Dr. Miller stresses the irreplaceable value of individuality, the distinctiveness of each case. He accentuates that expert advice is indispensable, considering every person may respond diversely to the disease and its assorted instigators. It's important to remember, he notes, that a unique medical history and lifestyle can drastically impact the effectiveness of treatment. His message rings loud and clear. For a precise diagnosis and a personalized treatment plan that respects the nuances of the patient's life, one must invariably consult a healthcare professional. Throughout the discourse, the words spoken materialize on the screen, permitting viewers to track the conversation, comprehend the facts, and enhance their knowledge about this intricate ailment. This dialogue between a medico, a learner, and a sufferer is not just a healthcare tutorial. It underlines the significance of patient education in managing chronic conditions. It stands as a testament to the power of knowledge, emphasizing how understanding one's own health can lead to improved health outcomes. Remember, health goes beyond merely existing, it equates to thriving. It's essential to underline the importance of constant learning and understanding. This consistent education and comprehension are paramount to maintaining good health. Therefore, continue to engage, absorb knowledge, and foster frequent discussions. Remember, the journey to wellness is an ever-evolving conversation, so keep it alive.